Hey guys, welcome back. My name is Mike from Rescue Academy here at EEI Emergency Education Institute in Coral Springs, Florida, and I'm here to talk to you guys about Etomidate. So Etomidate is also known as Amidate, is a non-barbiturate hypnotic. All right, it's used for sedation whenever we're going to be utilizing cardioversion or if we're going to be doing intubation or getting an advanced airway. It's used for rapid sedation, okay? It's fast acting and it's short acting, all right? I'm going to explain myself. Now, the dose for Etomidate is 0.2 milligrams per kilogram to 0.6 milligrams per kilogram. Most protocols are saying give just 0.3 milligrams per kilogram. Kind of easier for you to remember. Now you might be saying, hold on, I don't like seeing this decimal point. It's gonna make things really complicating. It's really not, all right? I'm gonna give you an example. If you have a patient that weighs 70 kilograms and you're using this 0.3 milligrams per kilogram, all I want you to do is take that 3 and multiply it by 7, that first number in those kilograms. What does it give you? 21, so 21 milligrams. If your patient weighs 90 kilograms, take 3 times 9 and you get 27 milligrams. Most protocols are gonna say the max dose for the adult is 30 milligrams. You might see in some literature that's saying 20 milligrams. All right, follow your protocol. With Etomidate, pediatric use, it's still 0.2 to 0.4 milligrams per kilograms. Do not use this medication if the child is less than 10 years of age. Okay, so this is not intended for small kids. Now, some contraindications for this medication. There's not many, okay, which is great. Hypersensitivity, which is, it's in every single medication. And then also your labor and delivery patients. So any patient that's going through childbirth, you do not want to be utilizing this medication. Another thing that I want to note about this med is that it's for one-time use. Okay, so if your patient starts waking up on you, we don't draw up Etomidate again. Now this drug comes packaged 20 milligrams in 10 mLs. 20 milligrams in 10 mLs. So if you do have to draw more than 20 milligrams, make sure that you're grabbing 2 different vials. Now, one thing I did want to talk about is the fast acting of this medication. Okay, so its effect is going to happen less than 1 minute per the book. I'm going to tell you right now from real life experience, you can count to 10. And this medication is going to knock them out, okay? Not knock out their respiratory drive for most cases. Now there have been cases, like I said, hypersensitivity, where somebody will stop breathing when given the Etomidate. I've never seen that happen. But there is one thing that I do want to point out. Push the drug slowly. Most literature is going to tell you anywhere from 30 to 60 seconds. Just go right in the middle, 45-second push. If you push it too fast, you're gonna cause what's known as trismus or lockjaw. It's going to throw a monkey wrench in whatever you're trying to do. If you're trying to get an advanced airway and now your patient's jaws are clenched tight, you can't get the airway. I've seen it happen in person, okay? Do not put yourself in that scenario. Push the drug slowly. Now, like I said, the drug kicks on really fast, but at the same time, it wears off really quickly. You got 3 to 5 minutes with this medication. Now I've seen our patients knocked out, we intubate, we're doing whatever we have to do, and all of a sudden the patient starts blinking on you. Bad sign, okay? If you want to stop this from happening, have a sedative ready to go. Whatever sedative you use at your department or at your job, have Versed drawn up, have something ready to go to keep the patient down. In the hospital setting, they're utilizing propofol. If you're a CT medic, you might be utilizing propofol. Most departments aren't carrying that kind of sedative. A lot of people use paralytics alongside this, so acetylcholine, which is also fast acting, but also wears off really quickly, rocuronium, vecuronium, things of that sort. This medication just drops the patient really fast, but they will wake up within 5 minutes. Make sure you have something ready to go to keep them under. And do not use this medication twice. Some adverse side effects that you might see with this medication, like I said, short periods of apnea, which is rare but possible. All right, hypoventilation, breathing rate starts to slow. Possible chance of hypotension, but very unlikely. Also nausea, vomiting, and you may even see muscle twitching or posturing. Typically, you're going to be seeing that if you're pushing the medication too quickly. So you're walking down the hallway of that ALF and you hear that patient with the rails that you could hear down the damn hall. You already know this patient's full and you need to drop them quick. I'm telling you, this drug is your drug of choice for intubation. Can I use this drug in trauma patients as well for head trauma? Absolutely. Okay, there's been many studies used with Etomidate to show that it's not increasing intracranial pressure. So utilize this medication for trauma patients as well. Another thing that I touched on very briefly is that this medication can be utilized with synchronized cardioversion. Now, I'm telling you right now, I've been there where my patient is crashing on me, their heart rate's extremely fast, and I say, okay, push the Versed. All right, let's get the monitor ready to synchronize cardiovert. And I'll never forget syncing that guy, and he screamed. I should have used something more fast acting than Versed. Etomidate would have put the patient out. I would have been able to synchronize cardiovert with no issues, and he would have woken up within 5 minutes. So this is another way that we should be utilizing Etomidate every single time that we're synchronized cardioverting. All right, guys, well, that pretty much concludes my Etomidate or Amidate discussion. If you have any questions about it, please feel free to ask. Just remember, when you are utilizing this medication, push the medication slowly. Have another medication or a benzo to back it up in case your patient starts to wake up, and make sure you are doing the correct dose. If you underdose any type of sedative, you may not get the effects that you're looking for. Well, guys, if you like this, please like, subscribe. If you have any questions, feel free to ask. I'm planning on making a lot more videos, not only about medications, but also about different skills, EMT skills, any type of first responder skill. So if you want anything in particular, just shoot me a comment, and I hope to see you all next time.